Hello, I am Dr. Ravikanth, consultant cardiologist working at Krishna Institute of Medical Sciences, Hyderabad. Today I am going to discuss about cardiovascular diseases in India, significant mortality as well as morbidity, and also is an important number one killer in our country. Globally also cardiac diseases including North America and UK, it's a number one killer. In our country also, it is recent census, according to recent data, nearly 22% of deaths, all deaths are related to cardiac diseases. In both men and women, it's an important cause of death, and it recently cardiovascular diseases have surpassed as a leading cause of death over non-communicable diseases like infectious diseases. First we will discuss about the ischemic heart disease, which is an important disease which affect the cardiac muscle, heart muscle. Ischemic heart disease means there is reduced blood supply to the heart muscle, and it can present as effort angina, which is related to activity. Whenever a person exerts activity or under mental stress or physical stress, that time he can experience symptoms related to angina. Second one is acute coronary syndrome, which can present as a heart attack. In addition to ischemic heart disease, there are other diseases which can affect heart, like valvular heart disease, hypertension, disease affecting the myocardium, which is called as cardiomyopathies, pericardial disease, and tumors, very rarely tumors. And in children, most importantly, congenital heart disease. Congenital heart disease can affect nearly 1% of the live births. So, as the coronary heart disease is the predominant disease which can affect the middle-aged people, and it can cause significant mortality as well as morbidity. It can because it affects the middle-aged reproductive age group particularly. So there will be a lot of socio-economic impact over the society as well as on the country. So today I am going to discuss about coronary artery disease. The presentation is mainly some people, when there is reduced blood supply, it can present as well as effort angina, and when there is completely blood supply is occluded, it can present as heart attack. Symptoms of heart attack are: there is retrosternal chest discomfort, that means there is discomfort in the either uneasiness in the chest or burning sensation or heaviness or some constriction like sensation in the chest, which can radiate to the both arms, particularly left arm, as well as in the back. Sometimes these symptoms of can present to the lower jaw as well as teeth also. So whenever somebody experiences such symptoms, they should immediately seek medical attention, and then ECG has to be taken, compulsorily has to be taken. If the ECG or history is very suggestive of acute heart attack, then he should admit himself in the hospital where cardiac emergencies are available. And treatment of the acute heart attack is mainly, one is pharmacological, that is the administration of the drugs which is called thrombolytic drugs. Second is angioplasty and stenting. Mostly, nearly majority of times, nearly 99% of times, heart attacks are related to the caused by the clot formation in the blood vessels supplying the heart muscle. So these blood clots can be dissolved by either giving medicine called thrombolytic agents. These thrombolytic agents have to be administered as early as possible. The earlier the drug is given, that they are more efficacious, they are more response and resolution of the symptoms are much better. Second form of therapy is called primary angioplasty and stenting. This is more efficacious than the thrombolytic therapy, but this primary PTC and stenting is not available in most of the centers in our country. Only these only few centers in metros and cities can perform primary angioplasties around the clock during emergencies. The rest of the country, like district level, villages, rural areas, this primary invasive form of treatment is not available. So hence one has to give thrombolytic agents. And secondly, following a heart attack, one has to continue medicines as prescribed their cardiologist. And this treatment is only based on individual. It can affect only person who had a problem or a heart attack. But in general, to prevent or reduce the cardiovascular burden in the society and community, we have to know the risk factors. There are many risk factors which can cause coronary heart disease. Importantly among them is diabetes, hypertension, smoking, high cholesterol levels, physical inactivity, obesity, that is overweight, and lack of physical exercise, and then family history of coronary artery disease. To prevent the development of these risk factors, we have to do changes in our lifestyle. Initially, the prevalence of coronary artery disease, if you compare in 1980s, it was only 1%, 1.5% in our country. And now presently, prevalence of the coronary artery disease is almost 10 to 15% in urban areas, 3 to 5% in rural areas. Nearly it has significantly increased in number compared to last 20 to 25 years. According to WHO estimation, these prevalent rates and incidence rates can double in another 10 years time. So we have, in addition to communicable disease, we have also now overburdened with the non-communicable disease like diabetes, hypertension, heart disease. So to prevent this non-communicable disease, particularly cardiovascular disease, we have to change our lifestyles. And most important lifestyle modification is physical activity. There are available data in one study published from Rajasthan, where among age group of 20 to 30, the most important cause of coronary heart disease is physical inactivity. That means nearly 20% of the age group between 20 and 30 years are physically inactive, and in the rest of the age group you have obesity, diabetes, hypertension, smoking, high cholesterol levels are contributing to coronary heart disease. So lifestyle modification is very, very important in preventive measures to control our cardiovascular burden in our country. So most importantly, physical inactivity, as I just described, one has to do physical activity at least 30 minutes a day for 5 days in a week, so that you can prevent the development of hypertension, diabetes and obesity, which can indirectly cause cardiac problems and stroke in later life. And secondly, stop smoking or quit smoking. This is very, very important, because in young adults the most important cause of heart attacks are smoking. So one has to stop smoking. Next, we have to control the overweight problem, which is predominantly affecting our society. So in India also, like USA, even nearly 15 to 20% of children are became more overweight and became more obese. We have double problem actually. In addition to undernutrition, malnourished in the children, we have also a problem of overnutrition in the mind, which can cause obesity and overweight in children. This obesity in children can lead to later life hypertension, diabetes and cardiac problems as well as stroke. So this weight control is an important important measure to prevent the cardiovascular diseases. To reduce the weight, one has to start doing physical activity and also diet control from younger age group. That is not after the development of the disease, but before the development of disease. That means from the age of 15 years onwards, children, whether children or adolescents, they should start practicing some form of sports, or they do physical exercise, so that in future they will not become victims of the cardiac diseases. And also other risk factors should be prevented, and also if they develop, then one should control them effectively. Next is hypertension. Hypertension is also very much significantly predominantly prevalent in our country. As the age advances, hypertension incidence also goes up. Above the age of 50 years, almost 30 to 40% of the people will suffer from hypertension. So to prevent or delay the development of hypertension, one need to take less salt and also do more physical activity if they are overweight. And next is diabetes. So all these preventive measures like physical activity, diet control, and next is diabetes. Diabetes, India is the diabetes capital of the world. So to prevent the development of diabetes, same measures like lifestyle measures which just described has to be practiced from younger age onwards, so that the diabetes development can be prevented. And lastly, high cholesterol levels. Normally the cholesterol is produced in the body depending on the genetic constitution of the persons. So if their cholesterol levels are high, then they should reduce avoid foods rich in cholesterol, as well as take drugs to control the cholesterol levels. So among the most important preventive steps, most important is lifestyle modification, is be it physical activity and diet control, avoiding smoking, taking less salt, and regular checkups with the doctors.